Hi, my name is Chen Cui. My friend Anne, who wants to lose weight very quickly, she thinks Lorcaserin is a good choice. I made a PowerPoint to give her some advices. Let's have a look. And I divided the whole video into 6 parts, which is introduction, mechanism of action, side effects, lead to disease, important data, and conclusion. For the first part, introduction, I'd like to introduce you guys about what is Lorcaserin. Lorcaserin is a weight loss drug developed in 2012 by Arena Pharmaceutical, an American company, also known as Belvic. It has long been used for weight loss in obese people. Lorcaserin is prescribed for obese adults with a body mass index it is BMI of 30 or more, as well as for overweight people with a BMI of 27 or more, who has high blood pressure, type 2 diabetes, or high cholesterol. And the recommended dose is 10 milligrams 2 times a day. The mechanism of action is very important to know. And here I have 3 pictures for this process. The first picture is hypothalamus, and the second one is 5-HT2C, and the third one is Lorcaserin. The hypothalamus, located just below the thalamus, regulated the metabolism of the nervous system, such as small organ control aspects of body temperature and hunger. The drug stimulates 5-HT2C receptors in the hypothalamus. 5-HT2C receptors pro-opiomelanocortin neurons were stimulated, causes the release of alpha melanocortin stimulating hormone is alpha MSH. By suppressing appetite, it promotes weight loss by increasing satiety. However, the Lorcaserin has many side effects. More commonly is anxiety, bladder pain, blurred vision, low blood sugar, mental problem, and slow heartbeat. The side effects were minor compared to possible medical effects of Lorcaserin. Lorcaserin withdrew from the market in February 2020 at the request of the Food and Drug Administration because a safety test found that drug users had an increased incidence of cancer, including pancreatic, lung, and colorectal cancers. And Lorcaserin is a long-term drug. If a patient does not lose 5% of their body weight within 12 weeks, these drugs may not suit for them. And 1-year-long study shows that Lorcaserin users lost 7.3 kilograms. The control group lost 3.7 kilograms without the drug by the second year. However, the patient had regained 25% of their weight. In conclusion, I don't recommend that use Lorcaserin to lose weight. The drug has been banned. Even though Anne achieved the BMI values used by Lorcaserin, her height is 1.62 meters and her weight is 80 kilograms. Her BMI was 30.4831. The drug has too many side effects. It also increases the risk of cancer. If you stop taking it, your weight will regain. And doesn't have any diseases. This drug is more suitable for overweight people with high blood pressure, type 2 diabetes, or high cholesterol and wanted to lose weight very quickly. Using Lorcaserin takes at least 12 weeks. It takes a long time. In my opinion, BMI over 30 is considered a big base weight. I think Anne can start with a diet change, like eating some good fats, reduce saturated fat and trans fat intake. Saturated fat usually comes from animal products such as pork, cheese, and butter. Trans fat is more fat-filled. People must eat less of weight loss. Increase your intake of unsaturated fat, like fish and nuts. Eating too much fat of any kind can make you fat. So, it's all about the right amount. It is important to improve the diet. Diet change with exercise is the most healthy way to lose weight. It will not easily rebound.